Welcome to the UAB Tone Your Bones Osteoporosis Education Series. My name is Beth Kitchin, and I'm the patient educator at the UAB Osteoporosis Prevention and Treatment Clinic. In the last segment, we talked about the risk factors for osteoporosis that you do not have control over. These were the biggies, like being a postmenopausal woman and aging. Well, now we're going to talk about the risk factors that we do have some control over. So let's take a look at these. First of all, if you have not been getting enough calcium and vitamin D, these are two key nutrients for bone health, then that might have contributed to your osteoporosis. Now, some of you may be getting exactly the right amount of calcium and vitamin D, and you need to keep doing that. However, if you're getting the right amount of these nutrients, then that's actually not a big risk factor for you right now. Those other risk factors are probably playing a bigger role. The next risk factor for osteoporosis is not getting enough exercise. Now, not everyone can exercise, but if you can, exercise can help slow down bone loss if that exercise is what we call weight-bearing exercise. Weight-bearing exercises are exercises where your own body weight is resting on your skeleton while you're doing the activity. So these are things like walking, jogging, dancing, stairmaster, treadmill, anything where you are standing on your feet on dry land, essentially, or on a platform. So these can actually stimulate the bone cells to slow down the bone loss if you are over the age of 50. Now, not everyone is able to get up and go for a walk or get on the Stairmaster or the treadmill. Maybe you have arthritis in the knees or other kinds of problems where you can't do those types of exercises. So you may get in the pool for water aerobics or get on the bicycle. These are not weight-bearing exercises. In the water's holding you up and supporting you, so you're not getting that stimulation to the bones. And when you're on a bicycle, you're essentially sitting down. Even though you're moving your legs, you're not getting that stimulation to the bones because your weight is not fully resting on your skeleton. Now, these may be the exercises that you have to do because you have limitations. And you know what? Even though these don't directly stimulate the bones, they are still keeping your muscles strong. And anything that keeps your muscles stronger in the lower body is going to help prevent falls. And of course, we know that exercise helps us with many other things besides our bone health. It helps with heart health and prevention of diabetes, and also with other things like arthritis and even our mental health. So we want you exercising and doing what you can. The next risk factor that you can control for osteoporosis is alcohol intake. Now, interestingly enough, there are some studies that show that people who drink a little bit actually might have stronger bones than people who do not drink at all. And so what we find is that moderate alcohol might, and I really stress might, be beneficial for the bones. Now, what is moderate? Well, it's kind of what you hear. For women, that is on average 1 alcoholic beverage a day or fewer per week. And the men get 2 a day or fewer on average per week. Now, this doesn't mean you can save them all up till Saturday night and have all 7 or all 14 of them, right? That would be very bad for fall prevention. So we really stress moderation. Now, if you do not drink at all, it really isn't worth your while to start drinking for your bones. The research isn't that strong. It's not like it's that beneficial for the bones. And of course, there are many problems with drinking as well. So we really stress with alcohol, moderation to none. And now the last risk factor for osteoporosis that you do have control over is smoking. And smoking is bad, of course, for many things. And it actually is bad for the bones as well. Now, it's very difficult to quit smoking. So if you are a smoker, please talk with your doctor about getting some help for quitting, because it's a hard habit to quit, but it can have huge health benefits. As always, talk to your doctor about your risk factors for osteoporosis, because this really helps them set up the best treatment plan for you. I hope you learned a lot about the risk factors for osteoporosis. Now you are ready to move on to learning about calcium and vitamin D.